All right, welcome back. Now it's time for us to talk nutrition this morning, and today we're going to be flipping the script a little bit and talking about something that's very, very critical in the world of nutrition. Now, cleft palate is a challenge that a lot of children, well, not a lot of children, but many children, are born with this condition. We're going to find out exactly what is cleft palate, how it comes about, and then how is it related to nutritional challenges. We've been joined on the set this morning by Esther Obing-Mensah, who is a dietitian. She is with Operation Smile Ghana, part of the nutrition team, and also Dr. Opoko Wari Ampoma. He's a medical director as well as a Ghana board member of Operation Smile. Doc, Esther, welcome.
Thank you.
All right. How are you doing?
You're doing great.
You're great.
Fantastic. Now, you wear 100 different hats, and this is one of them.
Yes.
What is cleft palate?
Okay, so cleft palate is a condition where a child is born with a gap in the roof of the mouth. So usually when the baby is being formed in the womb, there are various parts that come together to form the roof of the mouth. It's supposed to be completely sealed. Okay. But then due to some issues, this fusion or this closure doesn't happen. So the child is born with a gap in the roof of the mouth. So that is what we call a cleft palate. So a cleft is just a gap or a space.
It's a gap, yes. Okay, fantastic. Now, my interest really, and for the sake of this conversation, how does that create a nutritional challenge?
Okay. As Doc has already said, due to the condition, it affects the children, their feeding. And as a result, it ends up in malnutrition. So that is our optimum interest. That's what we are really interested in. And before they can have surgery, if their nutrition is not optimum, the doctor can test to the fact that they can't proceed with the surgery. So nutrition plays like it's the core center of the cleft condition before they can go ahead with the surgery. So nutrition play very key, because if their feeding is affected and they become malnourished, eventually their system will be down, and then surgery cannot take place. Yes, so nutrition is very, very key.
Now, Doc, how would you typically prep a child for surgery? Okay,
so I think because of when the child is born with an abnormality, normally for instance, in one part of the body, usually you have to look in other parts of the body to check for other anomalies. So sometimes the cleft condition occurs either in isolation. That's commonly in girls. Many of the girls who have cleft palate, it occurs as an isolated incident. Everything else is normal. Okay. Whereas for a significant portion of them, of the children, it occurs in associated with other anomalies, and some of it will occur for cleft of the lip as well, which is very obvious. So as soon as you look at the child, you can see that there's an obvious opening in the upper lip. And then for some of them, they may have issues with swallowing, may have issues with the heart, with even the other systems, the limbs. So some of them it's the brain, some of them it's the reproductive system, or the digestive system. That's so there are various. So once you see a child with a cleft, you need to take a second look and really examine them thoroughly to make sure that there's no issue in the other systems. And so because of that, we have a multidisciplinary team that assesses these children. So apart from the surgeons, we have the pediatrician, because they need to be looked after. The nutritionist is very, very, very key, and I'll come back to the role of the nutrition, since that's the focus of today's conversation. And then we also have the dentist, the ENT, ear, nose, and throat, because sometimes they have issues that affect their hearing as well. We also have the nurses who coordinate their care, and so there are various other people who come in, psychologists, because for the child they are oblivious of what's happening, but then for the parents it's quite a stressful condition. So we have all these people coming together to form that coordinated care team that supports the baby in their growth and development. And then depending on what other specific anomalies are present, then of course you may refer them to other cardiac surgeon or a general surgeon or a gastroenterologist and some of those. But those I've mentioned are the core team that actually assesses children. Of course, we also have the audiologists that come in when in case they have hearing problems. Now, with respect to the nutrition, why the nutrition is a challenge is that when babies latch onto the breast, and they are supposed to suckle the breast. So it's not really like sucking, as in how you suck from a straw, although we use the word sucking, but it's not really sucking. They actually milk the breast. So you need an intact palate, the roof of the mouth, because they press the tongue, they catch the nipple between the tongue and the roof of the mouth. And then by that kind of action, like bellows, they draw milk from the breast. So if there's a gap in the roof of the mouth, that action cannot happen properly, because it will surprise you that if a child has got even a cleft of the lip, all right, but the palate is intact, they can feed better. That's why the children with cleft lip actually look better nourished, because once they get the teeth, the nipple into the mouth, they're able to
do that action,
the tongue against the palate, so they're able. But for the children, if the child has a normal lip, but then the palate, there's a gap in the palate, then that child cannot do that action effectively. So they end up being malnourished. So, because they cannot feed very well, before they've taken a little food, they would have swallowed a lot of air, and then the little food that they've taken in, the ones they belch, then they throw up all the food out. And they also have like respiratory problems. Sometimes as they try to get the breast milk in, it leaks out through the nose. So the nutritionist comes in as in fact the nutrition is very, very key here, because nutritionists will now teach the mother various techniques, so that they can be able to deliver as much food to the baby as possible, so that the baby does not become malnourished. Because like she rightly said, if the child is malnourished, then we cannot perform surgery, because then surgery is actually going to be a risk to that child. In fact, some of the children who have not had this sort of counseling end up succumbing to other childhood illnesses, and then they end up losing their lives as a result, when they could have been helped. So the nutrition thing is really, really key.
All right, please walk us through how you help mothers, how you teach mothers to nutritionally, give their child the best capacity possible.
Okay, as Dr. rightly said, because of the palate, there's no connection. So at that point, we educate the mothers to help them in terms of expression, so they can use cup and spoon. There's a bottle, it's a specialized bottle. However, this is not given to every child. For those who have bilateral, some they have 2 openings. And then
wow. So that's even possible. You have 2 different openings.
2 openings right here. So with those people, we give them specialized bottle. And for those who have the palate as well, to help the mothers.
What's special about this?
Yeah, so you see, this is flexible. Unlike the normal bottle that is rigid and hard. And then with the nipple or the mouth of this, is also different from the normal feeding bottle. However, not all mothers are given. So for those who are not given, we make sure they use the cup and spoon. And we teach them how to position the spoon. We don't just pour the milk or whatever food we give the child into the mouth. We teach them how they position the spoon, so the child would gradually just sip in the milk, so it doesn't pass through the nose, as Doc has said rightly. And I'm holding something we call therapeutic food. It's ready to eat. It's mainly from peanut, that's granite. And so this is also mixed with minerals and vitamins, very rich in terms of the malnutrition aspect. It helps to fasten their build-up, and then also for the to catch up with their growth, to catch up with the nutrients that they've been deficient because of the lack of the swallowing and then the suckling of the breast. So this is very good. And so we use this a lot for the kids. Ready to use therapeutic food. Yeah.
Okay.
So this is what we use a lot at Operation Smile, Ghana. And so for kids that are below 1 year, we use this for children mostly, but for those who are after 1 year, even though we encourage them to use this, we also encourage the mothers to introduce family foods, the available ones, so that by the time their surgeries are done, if they are done with Operation Smile, they can equally continue to feed them with the available food that's around. And then also they can also be anemic, iron deficient. So we encourage them to give foods that are rich in iron, and so foods that are also rich in the minerals and vitamins, so fruits and vegetables as well. And personal hygiene is one key, because infection can set in we try to educate the mothers also how to take care of the feeding bottles and the feeding utensils and the water they use in feeding the children. And because they are special children, you need to take time whilst feeding. An average baby may take about 15 or 10 to 15 minutes during feeding, but such kids can take as long as an hour. So if the mothers are not psyched, that's where the psychologists come in to take their time. They can also be frustrated, and sometimes they can leave the child, and for a long period it can affect us. And because of the stigmatization, most of the mothers will hide these children. So that's the main purpose, that at least giving this platform to tell the mothers that there's an organization that can help them out. So they shouldn't hide the children. We need them to come out. I think that we'll talk about our coming mission. I mean, that's
yes. Talk to us about Operation Smile and the project that's coming on.
Okay, so generally, in terms of how common this condition is, in our part of the world, 1 in every 1,000 to 1,500 children were born with a cleft lip or cleft palate.
Wow!
And in fact, it's cleft lip or palate is one of the commonest birth anomalies, about the 3rd commonest.
What's known to be the cause?
Yes, so the cause, yes, there's a number of causes. So there are 2 main factors. One is an inherited genetic defect. Okay, so there are some genetic conditions that make you more prone to having a cleft lip or palate, right? So there are some things like Down syndrome. There are there's another condition, I don't want to talk big English here, you know, but there's another condition called Van der Wood, which is a dominant condition, which once that gene is present, the children will be born with cleft. So, cleft. So you can see that we have some where the grandfather had cleft, the father had cleft, then the child also, I mean, you know, so you can see that it's transgenerational. Okay, so we have those conditions. And then we also have those that occur less commonly, okay? So the number of these genetic, that when you inherit those genes, it makes you more prone to getting so it means your risk is higher than the average population risk. Then the other, so it's also environmental factors. So environmental factors, so things like, you know, all these chemicals and things. That's why, you know, this thing about, you know, galamsey and the pollution of the chemical pollution is really, really serious because it can result in you know, more birth defects in the population than you would expect. Then also have something medications. So there's some medications like anti-seizure medication, and some medications that are used for even things like acne, and some medications that are used to treat some types of cancers and other conditions. Some of those medications can also predispose you to getting a cleft. Even some things like even steroids, some of them can predispose you to getting a cleft lip or cleft palate. So those are factors that you avoid. And then when you also have, the mother has got certain deficiencies. So if your mother has got a deficiency, let's say folic acid and some of the vitamins, it can result. So that's why women are encouraged to, when they suspect that they are going to be pregnant or they are the fertile reproductive, they are trying for a baby, they should take folic acid regularly because it's very cheap, very available.
Okay, fantastic. And please, let's go quickly to the program that's happening.
Yes. So Operation Smile is an organization that is committed, is involved in 60 countries. We are, you know, we've been around since 1982 and it's been in Ghana since 2011. And we have committed to providing free surgery for children who are born with cleft lip and palate. So we usually do this in collaboration with a number of you know, hospitals around the country. And so Kolebu is the main center, and then we have some of the other regional and district hospitals that we partner with. So this time we are in Koforidua from the 15th to the 24th of June to provide free surgery for children who are born with cleft lip and palate. And so we provide we provide free transportation. We feed them for the child, and then one you know, parent or guardian, and then we house them for about during the period of the of the program, and then we provide them surgical screening, labs, all those things, and then we provide the surgery and then aftercare, and then we also follow them up afterwards. Okay,
so how do people get in touch with you? The number I think is on the screen.
Yeah, I think the number
is there.
We have some flyers.
Okay, all right, so that's the number there. Please, if you're watching and you're interested, kindly screenshot that flyer right now so that you can have access to it afterwards. All right, thank you very much for bringing this to the attention of the whole country. It's very important. gosh, I can't imagine what parents who have this challenge with their children must be going through.
Yeah.
You know, but
Yeah, it is psychologically very stressful, and so we have to give them all the support that we can. We can, and many parents get stigmatized. Sometimes some of them are hounded out of their homes because they think that the children are a sign of a curse or evil spirits and things like that. But these are all just myths, and a lot of these children grow up to become normal, healthy adults. I've seen doctors who were born with cleft and who are now normal and functioning and even supporting Operation Smiley's activities. So so these are people who can become useful people in society, and so we must give them all the support and help.
Thank you very much. We've been speaking with Esther Obing Mensah, who's a dietitian and part of the Operation Smile Ghana, the nutrition team, and also Dr. Opoku Ware Mpoma. He's the medical director and Smile Operation Ghana board member, and he's also the CEO of Kolebu, by the way, in case you didn't know that as well.